We're dealing with a crisis on a number of fronts. And I heard about all the goodwill here, but the reality is that your party has been in power for the 91 years out of the last 120. The policies of colonization and genocide have come from Liberal governments. So when I hear about no running water and a housing crisis, when I hear about the lack of adequate health care and the third world living conditions, these aren't by accident. They are a result of government policies that you and your colleagues have pushed over the years. So let's connect it to a crisis we're dealing with here and now, right now. People are very concerned about the disproportionate impact that the coronavirus is set to have on Indigenous people. We have to look no further than H1N1 to know exactly how hard it hit the most vulnerable, particularly people in my part of the country. Do you know the rate at which Indigenous people in our region were hit by the H1N1 virus in northern Manitoba? I'll help you with 6 times. When it came to Nunavut, it was 45 times.
What's your point of order? With respect, both ministers will be returning here on Thursday, and a lot of these questions with respect to the coronavirus and so on, I believe can be directed at that point. I think they're here.
With respect, it's a matter of life and death, and let me connect it to our discussion today.
I'm asking for his point of order.
Today they're here for very specific reasons.
I can't believe we're delaying this over questions on the coronavirus.
I'm suggesting that relevance is an issue here, Mr. Chair, and I do respectfully submit that this question could be deferred to next Thursday.
Ms. Ashton, go ahead.
And I respectfully, I'm shocked that it would be asked to be delayed when we know that the government isn't taking this seriously. Let me connect it to the Wet'suwet'en as well. Indigenous people in this country have had enough of the way in which the federal government, has ignored their needs, whether it comes from treaty land entitlement, whether it's land claims, and I include the North of 60 agreement that your government betrayed the Dene on, and they've had enough of the way in which living conditions in their region have been ignored. And so I'm shocked that I would be told that I should stay silent about an upcoming, a crisis that we're starting to live right now. And so my question is to the government: what are you doing to take action to make sure First Nations are supported? And perhaps you could also reflect on the fact that you're an alternate member of a committee. What signal does that show to Indigenous communities when the government doesn't even take Indigenous affairs ministers seriously enough to be a full member of a committee dealing with a nationwide global crisis?
30 seconds.
I can confirm with the member that I'm on the committee and participating fully. I'll leave it at that. We have a call. We have a meeting today, and I will be updating them on the issues that I'd be prepared to update you on the issues with respect to our engagement with Indigenous communities and our reaction and preparation for coronavirus, which is a very serious issue. I would preface my following comment with the fact that I don't think that the introduction of UNDRIP and the work the government did on it and the NDP did it on it, fostered by and put forward by Romeo Saganash's storytelling. I think it's very important. It's very important for Canadians to realize that. As with respect to coronavirus, Indigenous communities are more vulnerable for a number of reasons: historic socioeconomic gaps, overcrowding, lack of access to clean and safe drinking water, all issues that we as a government on a long-term basis and on a short-term basis with respect to the long-term water advisories we are committed to remove by March 2021. There are also systemic issues with respect to cultural approaches with medical facilities and healthcare, also access thereto and remoteness. These are all factors that have contributed, for example, to the unacceptable rates of tuberculosis in those communities. We have our experience from the H1N1 virus. I have a dedicated team that is working on surge capacity, and I'd be absolutely more than glad to update this committee or anyone willing to engage with me on these issues. Foremost, Indigenous communities, which we are striving to reach out to and already have done so, but we'll be increasing that capacity in the short term.
Thanks, Minister. We need to move